If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Hi, I'm Dr. Raj, and this is the Med Prep to Go podcast, and I'll be reviewing USMLE Step 1 High Yield questions, and I'm going to read 3 questions today from everyone's favorite topic, behavioral sciences. So to get more questions, go to our website, www.medprep2go.com, and this is a reminder that this is a free audio and online question bank, and to learn more about me, go to my podcast, which is the Beyond the Pearls podcast. And my other one, which is my favorite one, is the Dr. Raj podcast. Also, this Beyond the Pearls podcast I just mentioned is keyed up to my book series published by Elsevier. It's the Morning Report Beyond the Pearls series for Step 2 and 3, and my case report Beyond the Pearls, which is kind of geared towards Step 1. And I always love it when people follow me on social media. So check me out on Instagram. I'm even kind of embarrassed, but I think I have a TikTok thing going. I got peer pressured into it. What can you do? And Facebook and all that kind of stuff. So anyways, let's read some questions today. So this is going to be a 2-year-old girl presents with her parents at a clinic for a well child visit. Her mother expresses concerns that she does not respond to her name when called. She's able to run, walk, up the stairs, build a 6-block tower, play with other toddlers at a daycare, and says a few words, but mostly babbles. She does not say 2-word phrases. She is at the 45th percentile for height, 56th percentile for weight, and 57th percentile for head circumference. There is no personal or family history of serious illness. Which of the following is the most likely diagnosis? Is it going to be A, attention deficit hyperactivity disorder, ADHD? Does this patient B have autism spectrum disorder, C, hearing impairment, D, motor delay, or E, normal development? And the answer here is going to be, this is C. This patient's inability to respond to her name being called and a delay in language. Patients around 2 years old typically have around 300 plus word vocabulary. I got to tell you, that's pretty impressive. I mean, I have 3 kids. I've been through the works. My youngest right now is 3 years old. And I didn't realize at 2 years of age, you're going to have 300 plus words, but I'll take the writer's word for this. They could say 2 or 3 word phrases and can state their own name. There's a concern for hearing impairment if you don't meet these things. Her gross motor, fine motor, and social development are consistent with that of a 2-year-old. Hearing impairment is most often congenital and can also be acquired in certain cases. And if I had to give you a USMLE Step 1 Pearl when it comes to, hearing issues and antibiotics, because I am a critical care doctor and I love giving people antibiotics in my ICU. When antibiotics have been associated with hearing loss, I mean, you got to throw it out there, man. Aminoglycosides, when you're hanging out with the tobramycin, amikacin, gentamicin, of course, you got to worry about that. And we did have a lot of cases of those many years ago. So it is very unfortunate. In adult medicine, you definitely want to get a baseline hearing test if possible before initiating some of these medications. So I know I kind of went aside. I couldn't help but drop a couple pearls for you folks right there. So unaddressed hearing impairment can cause delays in speech, language, and cognitive development. Developmental language disorder is the most common developmental disability in children, affecting up to 10% of children. All children with speech impairment / delay should have a medical evaluation and audiology evaluation to detect hearing loss that may be contributing to speech delay. So answer choice A, ADHD, is incorrect. This child does not have a reported history of hyperactivity, impulsivity, or inattention that occur in more than one setting that would suggest attention deficit disorder. B, this one's really close to my heart. Autism spectrum disorder is incorrect. In this case, the child in the vignette plays with other toddlers and does not show restricted social interactions or stereotypical behaviors that would suggest autism spectrum disorder. And I do agree. I mean, when you do a board question, you've got to look at the vignette. But, I would be very scared and worried in this individual. Of course, that's why we do hearing tests. When we talk about the stereotypical behaviors, what they're referring to is things like what they call stacking, or things where they put things in order, like they love putting blocks in order and like that. But it's not always going to be like that. Autism is a spectrum. Some people could be really high functioning, and you can think about someone with kind of like an Asperger's type, syndrome, versus people who, unfortunately, it can be very severe. And people with autism, they have their different strengths and weaknesses. So very, very passionate about autism when it comes to kids and family. D, motor delay is incorrect. This child is demonstrating gross motor and fine motor skills that are age appropriate. And E, normal development is incorrect. This child has a language delay and is not demonstrating normal speech and language development. So what's the key learning point here, everyone? Speech or language delay is commonly caused by hearing impairment. Let's do another question. 40-year-old woman presents to the clinic with concerns that her depression has not improved despite treatment with cognitive behavioral therapy and fluoxetine, brand name Prozac, for the past 5 months. When asked about her depression, she states that she can enjoy pleasurable activities briefly before returning to her baseline level of depression. She has also noticed a heavy feeling in her arms and legs, and notes that she is constantly hungry. If she does not turn on her alarm clock, she sleeps for 12 hours straight, which she notes is unusual given that 8 months prior, she would naturally wake up after 8 hours. Which of the following second-line pharmacological therapies is most appropriate to attempt to relieve this patient's depression? A, buspirone, goes by the brand name Buspar. B, citalopram. C, lithium. D, tranylcypromine. I can't even pronounce that, but I'll spell it. TRANYLCYPROMINE. So tranylcypromine. Okay, I know someone's laughing at me. And the last is venlafaxine. I don't know why I can say venlafaxine so good. And that goes by the brand name Effexor. So which is going to be the right answer here? Well, me looking at all these weird choices, I can't say I would actually pick this clinically, but, in this particular case, probably the best one to combine would be the choice D, the one I can't pronounce, tranylcypromine. And does anyone remember what category of drug that is? Yeah, that's an MAOI, monoamine oxidase inhibitor, MAOI. So let's talk about this. So the correct answer is D. The vignette describes a case of unipolar major depression with atypical features. First-line treatments for unipolar major depression with atypical features is, of course, cognitive behavioral therapy and an SSRI. This patient has tried CBT and an SSRI, which is fluoxetine, Prozac, with minimal improvement in symptoms. So a monoamine oxidase inhibitor such as choice D would be indicated as a second-line treatment. In general, unipolar major depression with atypical features is characterized by mood reactivity, meaning being able to enjoy pleasurable activities but feeling depressed when the activity is over. Hyperphagia, hypersomnia, leaden paralysis, meaning heaviness in the arms and legs. MAO inhibitors are used as second-line treatments because they can precipitate a hypertensive crises. Of course, if they eat foods that contain what? Tyramine. So it's not going to be wine and cheese and all that, of course. Answer choice A, buspirone is incorrect. Buspirone is a 5-HT1A receptor agonist used in the treatment of generalized anxiety disorder. And on a side note, because I do see patients with this, when we talk about anti-anxiety medications, such as what would be a classic one, things like alprazolam, which is Xanax, it usually causes a sedative effect, makes you sleepy. Buspirone is actually good in the sense that it's a little more alerting. So let me just throw that out there. Choice B, citalopram is incorrect. This is an SSRI, and patient is already on an SSRI, and that could definitely potentiate a serotonin syndrome. Choice C, lithium is incorrect. Lithium is for bipolar disorder, which this patient does not have. Choice E is venlafaxine Effexor. This is an SNRI, which is a serotonin and norepinephrine reuptake inhibitor, and is used to treat major depression as well as had other clinical indications, and is not a second-line therapy for major depression with atypical features. So what's the learning point here, everyone? MAO inhibitors are indicated as second-line therapy for treatment of unipolar major depression with atypical features. Good one.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at MichelobUltra.com/courtside. Michelob Ultra courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at MichelobUltra.com/courtside for free entry deadlines, prizes, and details.
So let's do one more for this block. We have a 52-year-old woman presents to her physician with a complaint of loss of libido and interest in life since being fired from her job 7 weeks ago. She feels tired all day, which she attributes to the fact that she wakes up 3 hours earlier than usual. She has been putting on weight recently and has difficulty concentrating on doing daily house chores and activities and lays in bed most of the time. Which of the following is most likely the diagnosis? Is this A, adjustment disorder, B, atypical depression, C, generalized anxiety disorder, D, major depressive disorder, E, PTSD, post-traumatic stress disorder? And the right answer here is D, major depressive disorder. Major depressive disorder is characterized by the presence of at least 5 out of the 9 SIGI CAPS symptoms. Man, I remember SIGI CAPS when I was a med student. That was one of those classic acronyms, along with patient-reported depressed mood or anhedonia. It also lasts greater than 2 weeks. The SIGI CAPS mnemonic helps us remember the 9 symptoms. Are you ready for them? S is for sleep disturbances. I is for loss of interest, which is the anhedonia or being depressed. G is for guilt. E is for lack of energy. C is for lack of concentration. A is for appetite and weight changes. P is for psychomotor retardation or agitation. And S is for suicidal thoughts. So choice A, adjustment disorder, is incorrect. Adjustment disorder is not to be confused with generalized anxiety disorder. In adjustment disorder, emotional symptoms develop within 3 months of an identifiable stressor, lasting less than 6 months once the stressor has ended. That's not this case. Choice B, atypical depression, is incorrect. Atypical depression is the most common subtype of depression and is characterized by atypical features such as mood reactivity, latent paralysis, which is that heavy feeling in the limbs, reversed vegetative symptoms like hyperphagia or hypersomnia, and long-lasting interpersonal rejection sensitivity. MAO inhibitors can be used to treat atypical depression, but are not first-line therapy. Choice C, generalized anxiety disorder, is incorrect. Generalized anxiety disorder is anxiety lasting greater than 6 months in the absence of a stressor. Contrast this with adjustment disorder. Choice E, post-traumatic stress disorder, PTSD, is incorrect. Patients with PTSD have a prior history of trauma, such as a war memory, witnessing a death of a loved one. These patients have persistent hyperarousal, avoid social associated stimuli, repeatedly re-experience the events. They have nightmares. And remember, nightmares occur during what? REM sleep. And what differentiates nightmares from a bad dream? When nightmares, you wake up from it. And sometimes you develop a secondary insomnia because you're scared of having these very scary, vivid dreams again. So if this affects you during the day, we call them nightmare disorders. And have a change in cognition of mood, all lasting greater than 1 month. So the learning point in this case is major depression is characterized by the presence of at least 5 out of the 9 SIG-E-CAPS symptoms, with the patient reported depression lasting greater than 2 weeks. So hope you folks enjoyed the questions this time around. I totally love talking about behavioral sciences, and I really try to put some sleep in there and incorporate some autism in there. Those are going to be high yield topics for the boards. And to check more questions out, go to www.medprep2go.com.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.